Hello, everybody, and welcome to our December 2024 ACAP webinar. And today we're so thrilled we're going to hear research from the next generation. And from this picture, it looks like the next generation is female. I'm so excited that we have so many uh, young women that are interested in gerontology and interested in research and will be leading these efforts in their various countries as we move forward. It's so wonderful to see the next generation. So I am giving thanks, of course, to the Barbara Cox Anthony Endowment on Aging and the University of Hawaii for their support of ACAP and this webinar series. So ACAP, for those that do not know, is the Active Aging Consortium Asia Pacific. And our mission is to share friendship and best practices for active aging. We have several benefits, learning from each other, a quarterly bulletin, a monthly webinar, and conference participation. Speaking of which, we will have a conference coming up. But first, I'll tell you that we have 1,400 members or more from around the world. We just got some new members from India the other day. And we continue to expand our network of gerontologists. Our main draw, I think, is that we're very friendly and our organization is free. So if you want to join a free, friendly organization, you can just email me and I'll put you on our listserv. I just wanted to show you the topics of our 2024 ACAP webinar series. And clearly, I did not update this slide because we're not in November, we're in December, and we're doing the next generation of gerontology researchers, which is very exciting to us. And this is a slide that I updated, and I wanted to give a special thanks to Dr. Takeo Ogawa. He is the founder of ACAP and first president, and the best conference organizer in the world because he is able to find support for the ACAP 20th anniversary conference in Fukuoka in March. And we're looking forward to having a reunion of many of our ACAP family members, and we haven't seen each other in person since before COVID. So, Takeo, I don't know if you want to say anything. Register by January 31st.
Yeah, and I'm now preparing the very good ceremonies and also the vivid symposium discussions. And also we are preparing the study tour in Fukuoka City. Also, if this is a optional tour to the remote islands, Nagasaki, Goto Islanders. And maybe you can learn many things in Japan. Please come to Fukuoka and we will meet on site in Fukuoka. Yeah, I hope so.
Yes. So the conference is the 17th through the 19th, and then that includes a study tour of Fukuoka, but then there's the additional study tour to Nagasaki, and that is a beautiful part of Japan. I hope that you can go. We're going to get more information, but I think the Nagasaki tour is the 20th through 23rd or something, 20 through 22nd or 23rd. So still working on that. So the website, there is a QR code there, and then you can register by January 31st. There's also going to be abstracts accepted. I don't know if the abstract is available yet. The abstract is on the website, is it? Okay, so you can submit an abstract and all abstracts will be accepted, is what I understand. Yay! So many people need to be able to present in order to get to go, and I really appreciate that. Okay. So today we have actually more than 60 people who registered, and they're from more than 15 countries, and I've listed here. And we even have someone who's registered from Myanmar. That was the first time I've seen someone from Myanmar. So this is very exciting to see how we're expanding our network. Welcome, Gazala. Happy to see you here. So today it's here is our panel, and I'm going to turn it over to our moderator, Dr. Kaysorn from Thammasat University. So Kaysorn is our representative for ACAP in Thailand, and she has been very active. She's always enthusiastic. She is a wonderful advocate for her students, and she is always promoting her students and promoting older adults. It's very refreshing, Kaysorn, to work with you, and I appreciate you so much. And I know also that Dr. Ogawa appreciates working with you too, and I know you have many joint projects with Japan, between Japan and Thailand. So congratulations for all your hard work. So I'm going to turn it over to you. I will say that we have five fantastic speakers today who will be giving a brief introduction to us of their research. And I don't know if this is in order because Kaysorn will moderate, but Nargis is here at the University of Hawaii. Kanyapak is there in Thailand. Chulaluk is in Thailand. Naruman is is also in Thailand, and Jennifer is coming to us from Australia. So a very exciting meeting. So I hope my slideshow will cooperate and leave so that I can stop sharing. And there we go, and turn the floor over to you, Kaysorn. Thank you so much.
Thank you very much, Catherine. Thanks for your kind support. Always support us. Not only the young one, also senior one. They get support from you in terms of the academics activity and particularly your view, your idea on the aging issue and healthy aging. So I really appreciate. So today, welcome all of the audience on Zoom. I'm Kaysorn Sumpowthong from Faculty of Public Health, Thammasat University. I'm very pleased to be here as a moderator. Actually, we start this kind of topic last year, and I think we can do more. And I hope that next time, probably in the middle of the year or whatever, we have males, young researchers come and join us. Yes. So today we have five presenters, and I will order them as shown in the flyer. I hope that it's okay. Start with Nagi Southerners. Can I have a very, very short introduction for the speaker because we have a very short time for each one. And then we go to Kanyapak Ngausi from Thailand and Julalak Narimon. And the last but not least is Jennifer. Is that okay for everyone? Yes. And each one will have about 10 minutes and I will leave the question at the end. Probably the audience can put the question in the chat box so that the presenter can read their question and prepare to entertain you at the end. Yes. Can I have Nagis Satana now? Nagis is a PhD candidate from the University of Hawaii at Manaus, and I understand that she worked with Catherine. She, yes, she told the topic today is the older adults' perception and preferences on accessibility and quality of urban green spaces for physical activity, a photo voice study. It's my first time to hear about this, so very excited to hear. Yes, time for you, Nagis.
Thank you, Dr. Kaysorn. Can you hear me now properly?
Yes.
Okay, I will share my screen.
Just wanted to say hi to Sunghae and Brian and those who joined us.
Hi.
Uh,
Hey, can you all see my screen?
Yes.
Okay. Oh, thank you. And aloha, everyone. I'm in Hawaii, so greetings from Hawaii. My name is Nargis Sultana, and today I'm going to present one of my studies from my PhD dissertation that I recently just finished last week. And where I investigated older adults' perception and preference on accessibility and quality of urban green spaces for physical activity using photo voice method. So giving a little background about my study, physical activity. So physical activity is one of the determinants of healthy aging. Regular physical activity promotes physical health. For example, it reduces risk of chronic disease like heart disease, diabetic, etc. It also enhances mental health by alleviating depression and reducing cognitive declines. And outdoor physical activity fosters social connections, which reduces social isolation for older adults. So my study is in Hawaii, but I couldn't find any granular data. So I just used a state of Hawaii's data to show in state of Hawaii, the physical inactivity rate among older adults is lower than the entire United States. And also there is another good sign is the inactivity rate going down slowly. But however, state of Hawaii and Honolulu County have higher percentage of older adults than the national average, like national percentage, like within United States. Moreover, the percentage of older adults in Honolulu County is increasing and projected to increase until 2040. The trend is similar to the worldwide population increase in urban area. Globally, since 2010, urban population have been increasing due to rapid urbanization and population growth. Today, more than half of the world's population lives in urban area. And globally, the number of older adults living in urban area rose from 160 million to 355 million between 1990 and 2015. Many studies show that older adults are more vulnerable to sedentary behavior in urban environments due to a combination of physical, social, environmental barriers based on based on the increased population we noticed in Honolulu County. So it's very crucial for the Honolulu County to take an approach to create an age-friendly city to meet the older adults' needs in future. So realizing the worldwide population growth, WHO, World Health Organization, recommended to follow all the cities to follow age-friendly community framework from 2007, which identified 8 domains of urban life that impact the health and well-being of older adults. One of these domains of that framework is outdoor space and buildings, which includes urban green spaces, public areas, open spaces, and buildings, and which also focuses on creating a physical environment or built environment to promote health and well-being of older adults by providing safe and accessible spaces. So urban green space, in my study, I'm using urban green spaces, but I'm narrowing down to just park. So urban green space is one of the components of outdoor space and buildings domain and recommended by WHO to use as an intervention to improve social, environmental, and health outcomes of older urban dwellers. Urban green spaces includes parks, sports ground, urban forest, greenways, community gardens, and cemeteries. Various research showed that exposure to green spaces offers positive physical and psychological impacts on its users. However, accessibility to urban green spaces is an elementary condition that encourages the use of urban green space or parks, especially for vulnerable communities like older adults. So accessibility, what is accessibility? An accessible environment refers to designing or modifying an environment that enables access to everyone without facing any barrier to get access to that facilities. So for my study, as I mentioned, my study area is in Honolulu. I use photo voice method. Photo voice is actually a participatory action research methods, which is created by Caroline Wang and Mary Ann Burris in 1990s. In the photo voice process, participants are asked to take photographs that reflect their needs and concern for given issues in community, and are also asked to write or express their thoughts to complement the photograph they took. So Wang and Burris also created a show-it tool to conduct, to gather the data from the photos that are taken by the participants. But in my study, I used a modified version of show-it, which is the questions you can see below. And a little background, giving a little background about my participants. My participants are from the Senior Citizen Club member, from the Senior Club of City and County of Honolulu's Park and Recreation Department. So one of the park is there are about like 50 parks around the island. So these park members are in Makali District Park. So about 7 individuals participated, 6 female and 1 was male. And their age range was between 60 to 83. And most of the participants visited park 4 to 5 times a week, including their coming to the participate in the senior club activities. So findings. So 7 participants took about like 48 photos. And then so that about like 60 photos represented features that are facilitator, and about 40 photos was as barriers. So based on our discussion, the focus group discussion, I organized and categorized the photos. The highest number of photos were taken for safety and seating arrangement, followed by maintenance of park ground, and also followed by paved parking and signages around the park area. In the following few slides, I'm just gonna give some examples of the photos I took and the quote we got in the discussion session. So the left side photo participants took, it's about safety. Both photos are about safety. The left side displays the presence of police car in the park, in the parking space, and the right side photo is showing that its right photo is as a barrier where participants try to display the presence of an individual without housing living in that shelter, which the participant mentioned is keeping people away around the park, keeping them away from using the park. The next photo is paved parking, and to the left side you see again those small cars. You can see those are actually police cars. So even though ample parking, but this photo actually used as both for facilitator and for barrier. The barrier because it is a public parking, a park area. Police cops are parking there, and also the participant mentioned nearest school are also using that park. So when they come for their activities like using swimming pool, they have to wait. Sometimes they can't find parking, they have to go back. And then to the right side is another park where the participant showed there's the ample amount of parking there. Next photo is about maintenance and paved walk. Both photos showing the importance of having paved pathway. The left photo shows the lack of maintenance, which hindering from using the walkways, and right photo shows the need of pathways in the parking to attract more people to do physical activity in the park. These are some examples of what participants mentioned in the focus group discussion, and also they took notes, and I took notes, field notes when we were doing the photo voice studies. So some of the limitation I have, the managing the photos. Some participants had Mac computers, so they took photo and they downloaded in their computer. And when they sent me, I couldn't open it. But next day when I saw them, they printed it and gave it to me. So which is kind of, I was so lucky, I should say. Participants bias, I had a feeling because they're the member of that part. So all the photos they took for that part, it seems like facilitator. So they didn't focus any barriers. All the other parts had lots of barriers. And the scheduling photo voice meeting, it was kind of hard because photo voice requires multiple meeting, not one time. So, and their schedule, they are so busy. Their schedule calendar was so packed until the end of the year. So I had hard time, but I was lucky. They said, oh, we'll find you time. No worries. We'll do the photo voice. So I was overcome. It was limitation, but I thought that's also a positive side. So creating age-friendly cities, it's like a multi-departmental approach. As we saw, that features are like coming from different aspects. See, urban planner, city and county, parks and recreation, Department of Transportation. So it will require a collaborative approach from various sectors to make it accessible and age-friendly. So urban policies, maybe urban planning policies needs to prioritize age-friendly, accessible urban parks. Also, Department of Parks and Recreation, they needs to be aware about what's going on their ground. And also they need to be active to promote age-friendly spaces with accessible path, providing seating arrangement, exercise equipment, and maintaining the park ground and ensuring safety. In broader aspects, by creating an environment that supports active aging and promotes physical activity among older adults will help meet the goal of WHO in achieving the accessible urban facilities and our outdoor spaces for older adults. And that was my last slide. I would like to thank Dr. Braun for supervising and guiding me throughout my PhD journey. And also thanks to Dr. Kaysorn and ACAP for giving me the opportunity to present in this forum. Mahalo, and thank you for everyone for listening.
Thank you so much, Nagis. This is amazing. Yeah, I like the way you collect the data and also the result is amazing. Yes, I think there are many questions that would like to ask, but we have a very short time. So please put the question in the chat box. Yes. And yeah, I agree with you that one photo can explain 1,000 words. So this is a very clever way to do. Yeah. Shall we go to the next presenter? Yes, Kanya Park Ngausi. I introduced her at very short. She holds her bachelor degree in public health and master degree in economics. And today, and now she works with the Thailand Development Research Institute in Bangkok. And she will present to you longevity society, health and economic challenges for young generation. Let's hear from Kanya Park. Kanya Park, please.
Yeah, thank you, Professor Kaysorn. Let me share my presentation.
Yes, I can see your slide.
You can. Oh,
Yes,
okay.
yes, I see.
Okay.
We can see them.
Okay. Thank you, Professor Kaysorn again, and thank you all ACAP members for giving me an opportunity to share my research interest in the future. This is my research concept notes. I have not do the research, and I hope to conduct this research at the University of Hawaii in the future. And now my name is Kanyapak Ngausi, and I am a researcher at GDRI that Professor Kaysorn mentioned earlier. And the research presentation title is Longevity Society, Health and Economic Challenge for Young Generations Yeah.
Nó là ga làm thế này, ở trên nào nhé.
Go on, Kanyapak, it's okay.
Okay.
Next.
Yeah, I will start by background and my research question on this study, and next to I will highlight the main goals and my objective, and then I will discuss the possible approach and methods I plan to use to adapt this research question effectively, and finally I will outline the my anticipated result and the contribution this research would be made to policy, to society and young generation in Thailand. Let me start the overview of the global population situations. The information show that the phenomenon of population aging is occurring rapidly, and the UN forecast that the global population aged over 60 years will reach 1.2 billion by the next year, and at 2 billion by the 2050, which is will be about 20% of the world population. And additionally, the average life expectancy is about 73 years, with women generally living longer than men. I think this demographic shift is one of the global challenge. Yeah, decrease birth rate and increase life expectancy. Let's look at the top 10 countries by the number of older persons in 2023. Last year, we found that Asia had the largest population of older persons. That number as projected to double by 2015, surpassing the combined total of all other regions, followed by the European, Latin America, and Caribbean, and North America, respectively. Among the top 10 countries with the most older persons, 4 are in Asia, yeah, including China, India, Japan, and Indonesia, respectively. And China has the largest number of older persons. And move on to the aging among ASEAN member countries. The information show that Singapore had the high proportion of older persons, and making it the first country in ASEAN to transition into the complete aged society, following the Singapore, Thailand, Malaysia, Vietnam, and Malaysia. It is noted that both Singapore and Thailand have more older persons than children in their populations. And the situation of complete and the situation of aging society in Thailand, the information indicate that Thailand had the population now approximately 66 billion people, with about 13 billion people aged 60 years and over, mostly 3 billion more than the population of children. I think this situation lead Thailand near to the status of complete aged society. This is to illustrate the current station of older person in Thailand and to present perspective of challenges and opportunity in the future for policy maker. I try to summarize the longevity society challenges in Thailand and I found that there are at least 6 main challenges, and I will focus on the income, economic security, and the health challenges. I think we should prepare a longevity society, especially to main critical top issue, that is healthcare challenge and economic security. In terms of healthcare challenge, the rest in non-communicable disease among the elderly pose a significant challenge for the healthcare system, requiring innovative approach to disease prevention, management, and long-term care at the community level. And these challenges are not exclusive for the elderly. They also extend to working age population, emphasizing the needs for proactive approach to health across all age group. And the economic security, I think preparing for financial security in a society will increase longevity is crucial, and many older adults are living independently and working longer to make up from the support that once received from family members. The economic factors significantly impacts on health and influencing well-being in both younger and older generations. And I believe that addressing to these two aspects, healthcare and economic security, can lead to a more holistic approach to well-being in the longevity society. That means maintaining an active and fulfilling society life in the latter years is equally important for overall well-being. And I think we can better prepare for these challenges and bring and ensure the higher quality of life for all generations. And this is my future research. I will focus on understanding how Thailand demographic shift to an aging population impacts health-related quality of life across different generations. This understanding will virtual to informing future policies and improving well-being in the longevity society for all generations. And the key questions of my research study, first is, what is the impact of demographic, socioeconomic, and health-related factor on the health-related quality of life? And the second question is, how can we develop evidence-based policy recommendations for policymakers to support people in improving health and well-being within a longevity society. This slide, I show the objective study and potential method. First objective is to review the current state of health-related quality of life research and identify crucial factors affecting health-related quality of life across different generation groups in Thailand. And by using the scoping review method, the second objective is to assess the health status of Thai people, using the EQ5D5L through, especially in Thai version, to better understand their quality of life and classify the health status of different generations in Thailand. And the third objective is to estimate and analyze the cultural relationship between the health-related quality of life factor and relevant demographic, socioeconomic, and health factor, and another health factor by using the structural equation modeling. I think using the structural equation modeling can lead to develop the evidence-based policy recommendation. Okay, this is more detail about the methodology. The scoping review in overall is to scan and include the article or research study into the criteria, and after we pull the article, after that I analyze and synthesize the finding to identify the key themes, trends, and patterns, and report the factual finding in the narrative or descriptive format. And the EQ5D 5L assessment is this is easy to use. This is a questionnaire easy to use to calculate the health status of people. And the structural equation modeling, this model, I will draw the model by using the finding from the scoping review and the health status assessment, and develop the structure of factor that I would like to estimate the relationship. So this slide, I plan to conduct this study with the Thai population living in urban area, and I will categorize into 4 age groups shown in the table. Yeah, this cross-generational approach, I think it will provide valuable insight into the health-related quality of life and its influencing factor across different states of the longevity society. And the last presentation, I would like to express the expected outcome and contribution of this study. I think that the scoping review and structural equation modeling will provide a comprehensive understanding of the factor influencing the quality of life of Thai people in the context of longevity society, spanning demographic, socioeconomic, and health-related domains. And I think that the research finding will inform the developments of evidence-based policy recommendations to support people in improving their health and well-being, addressing challenges such as healthcare, economic security, and lifelong learning. And the last expected outcome, I think the innovative approach by combining scoping review and structural equation modeling to examine health-related quality of life in the context of longevity will make a vulnerable contribution to the existing literature and provide framework for the future research in this area. Thank you very much. This is my presentations.
Thank you so much, Kanya Parks, for your excellent piece of work that you prepared to do for your future research. I think it's very important. I agree that the young generations in longevity society should learn more, and we still have so many gap of knowledge about this, particularly when you apply economics into public health and tell us about what we should do. And policymakers should hear from you how to prepare for the future. Yeah, not only baby boomer to concern, but the young generation have to be really concerned about that. Thank you so much. Yeah,
Thank
I
you,
think
Ms.
we have some questions, so you can go to see that. Go to the next presenter, also the young generation, Julalak Chaipeng. She's a lecturer at the Faculty of Nursing. That is Sisawarin Tires Cross Institute of Nursing, and she belongs to adult department. Is that right?
Yes,
Julalak?
adult and
Yes, yes.
gerontological nursing department.
Yeah, adult and gerontological nursing. And she will bring to you today is innovative development raises awareness about dementia in the community. Wow, this is very, very concern for at present in the future for dementia for older adults. Yeah, Julalak, please, time for you.
Okay, thank you, Dr. Kaysorn. Let me show my slide. Okay, everybody can see my slide? Okay, thank you, Dr. Catherine. Yes, good morning, distinguished guests, and Sawadee Kha from Thailand. My name is Julalak Saipang. Currently, I'm nursing instructor in adult and gerontological nursing department and founder of Esteem Excellence Center at Sri Salunthila Thailand Scott Institute of Nursing. First of all, I would like to say thank you to our host, Dr. Kaysorn Sumpowthong, to invite me and our team to be here. Today, I would like to present my research in topic innovative development raises awareness about dementia in the community. However, the research is ongoing in the process. I divided my presentation into 3 parts, including firstly, why am I interested to do the research and my turning point. The second, what am I doing now? And the lastly, what I'm going to do in the future. Let's move on the first part. During I studied master degree of nursing in gerontological nursing, I interested in delirium or acute confusional state care in the elderly people who admitted in the hospital. I saw this phenomena when I was a registered nurse in the hospital. Therefore, I created my thesis entitled Acute Confusional State and Management by Healthcare Personnel among medical elderly patients in a tertiary care hospital. After I graduated, I continue to conduct research in this topic because I want to develop my expertise. This picture shows the last stage of my research in topic development of participatory care model for hospitalized elderly with delirium. In this research, we start with need assessment of elderly patients who admitted in the hospital. After that, I developed the model of care with the multidisciplinary care team. This picture shows the guideline how to manage delirium in the elderly who admitted in the hospital. After that, after I graduated, I have responsibility for teaching genetic nursing in the ward and the community. Furthermore, I'm accountable for doing the research and providing the nursing service for the elderly in the community. You can see my activity in this picture. In this picture, show my activity in the community. And in this picture, show my activity for teaching nursing students in the community too. At the last year, I provided the nursing service in Sansuk community at Dindang district, Bangkok, Thailand. I found that most of elderly people in Thailand, approximately 80%, they're living in the community, and approximately 70% of them are active aging because they can do daily activity well by themselves. However, when I screening my cognitive impairment or MCI in 42 elderly people in this community, I found that approximately 90% of the elderly in this community have my cognitive impairment. and my cognitive impairment leads to dementia in the future. In this situation, led me to be interested in my cognitive impairment and dementia problem in the elderly who living in the community. This is my turning point from the acute confusional state or delirium to my cognitive impairment and dementia research. My finding consistent with the report from the situation of the Thai elderly in 2016. From this report, they found that prevalence and incidence of dementia increasing in elderly people or genders, males and female. You can see this graph. They are predicting the incidence of dementia will rapidly increase compared between 2016 and 2037 is trend to increasing. However, from the literature review, they found that providing information about the disease, its effects, how to screen for early signs of dementia by themselves, and receiving rapid screening from the healthcare personnel can prevent dementia. You can see this picture. This is the lecture show the cognitive change in the elderly. They start with the normal. After that, they have aging change when they older. After that, they have cognitive decline and mild cognitive impairment and end up with the dementia. However, I believe if the elderly and caregiver or people in our society are aware early signs of the dementia, they can prevent the elderly people from this disease. In addition, this year I went to participate in ACAP study tour on Fukuoka care challenges. This activity inspired me to see the importance of raising awareness about dementia in the community. I saw an example model to raise awareness about dementia in all age and humanity care. Thank you, Professor Dr. Takeo Ogawa, for amazing experience. From this situation and my experiences, we are aware of my cognitive impairment and dementia problem in the elderly who living in the community. Therefore, I and our team are interested in developing innovative development arises awareness about dementia in the community. The outcome of this research that we are expected to consist of innovative to create awareness, such as maybe the activity or a mobile hub media that prevent the elderly from the dementia or mild cognitive impairment. The second, we expected can develop the online sales assessment through the web page. And finally, we hope to develop the community database to collect the data and monitor the cognitive change in the elderly who living in the community. I think all of innovation leading to the dementia-friendly community in the future. In this research, we use for network participation. For network participation is mean including the primary care setting or primary care unit, community, school, and temple. For Thai culture, we have a close relationship between primary healthcare center, home, temple, and school. One community that consists of home, temple, school, and primary healthcare center. I think raising our dementia awareness in the children at school or monks at the temple are influential to health behavior in the elderly people. For example, I believe if the children know about dementia or they can primary assessment the dementia, they can primary screen or recommend this knowledge to their grandparents. Yes, therefore I think this is a closely relationship between for network participation. And for the research design, in this research, we plan to use the process of participatory action research or PAR. The method is divided into 4 steps. Thirdly, study the situation in the community. Secondly, innovative development. Thirdly, check the result of innovation. And finally, apply research project for the public. Let's move to the first step. The first step, study the situation. We select the setting at the Pangkuthon community because from the primary survey about the cognitive problem in the elderly from 131 older people in this community, we found that most of elderly people who come to assessment are women, and approximately 58% have cognitive impairment problem. In this step, we use a focus group interview. The sample consists of four network participation, and the data will be collected until saturation and analyzed using descriptive statistics and content analysis. This figure shows the activity when we primarily survey about the cognitive impairment in the elderly people who living in the community. For the next step is innovative development. In this research, we use mutual collaboration approach. Mutual collaboration approach of stakeholder participation. The sample in this study consists of 4 network participation, same in the first step. We will be developing an innovation with the research team and the community. The outcome of this phase, including innovative create awareness, online self-assessment tool, and community database tool, monitoring the elderly in the cognitive change. And I hope this outcome leading to dementia-friendly community research. The sample group consists of 135 elderly people in the community. The data will be analyzed using PAT-T-test. For the last step is to apply research project for the public. We plan to organize hybrid seminar and policy talk to present the outcome of the research. The sample group in this step consists of 200 people in our society. Now, this research has been submitted to the Thailand Science Research and Innovation Organization in the grant topic Innovation and Development to Support an Aging Society. Now we're waiting for the funding and institutional review board approval. And the last topic is in the future plan. In the future plan, we plan to do the research about the development program to delay and prevent dementia for the elderly in the community. And I want to integration between nursing service research and nursing education. This is my plan in the future. Okay, for the last slide is thank you for your attention. If you have any questions or if you want to collaborate the project in the future plan, please do not hesitate to contact me from this email. Thank you so much.
Thank you very much. Thank you, Julalak, for your excellent work. Yes, we look forward to see the policy brief and policy talk from your research. And congratulations for you will get the grants very soon, right? Yeah, for this project.
Thank you. Thank you. I hope so.
Yes, this is very important for us now. Yes, and particularly when the situation is seen to we have so many factors that attack the elderly, particularly in the big city like this. And although we have service in Bangkok, in big city in Thailand, but the way they can, get to the service and protect themselves from the thing that gonna happen is still needs some more to do, and innovation is kind of the answer for our this kind of thing, because if we do the same thing in the past, the result will be the same, and we cannot solve the problem. So thank you so much. And yeah, I love your work very much.
Thank you, Dr. Kaysorn.
So now we come to the fourth speakers. Yes, they come from the same institute but different department. Narumon Sawangsi from Community Health Nursing Department, and she will talk about dementia care knowledge management. Yes, so love to hear from her. Narumon, please.
Yes, thank you, Dr. Kaysorn, very much. First of all, I would like to say thank you, Dr. Kaysorn and ACAP for inviting me to be here. And good morning, all participants. I am Narumon Sawangsi, a lecturer in community health nursing from Sisavarinjila Thailand Institute of Nursing. That you can remember in the short name is Estin. And now I am a part of Estin Excellence Center. Okay. Today, I would like to share my experience on 3 topics regarding research from the next generation. First, I would like to share my experience from a beginner until I became a researcher. Second, I would like to share my research project, which emerged from collaboration of my network. And third, I would like to share what I will do in the future. First, I invite you to see my experience as a beginner until I became a researcher. I started to do the first research by Assistant Professor Dr. Panisha Bunsawat gave me a chance to join her research. The research aimed to develop a multicultural care curriculum for persons with dementia and elderly with dementia in Thailand. The research design is a mixed method study, including qualitative and quantitative methods. This project is divided into 2 phases. The first phase aims to explore competence of professional nurse, and the second phase aims to develop a multicultural care curriculum. And now we are working on the first phase. We have already collected the data in 4 regions of Thailand, including Southern region collect data at Suan Saradom Hospital. Eastern region collected data at Queen Sawang Wattana Memorial Hospital. Northern region collected data at Lampang Hospital. And Central region collected data at Chao Phraya Yamaraj Hospital. Another is the Northeastern region that we will be collect at Khon Kaen Hospital, and now we are waiting for research ethics approval. For as the result, we have seen that core competency require a consistently positive attitude, integrated knowledge, and skill. I will explain more. For positive attitude, focusing on understanding dementia, individual with dementia, and caregiver. For integrated knowledge for dementia care, including specific knowledge, soft skill, and mindfulness. Skill for dementia, focusing on communication, managing behavior, ensuring safety, cultural context, and designing living environment. The gap of knowledge from this project is professional nurse in Queen Sawang Wattana Memorial Hospital have limitation of knowledge, attitude, and practice that affect the standard of dementia care. Next, I will share the lesson learned from my experience. I think the mentoring system is important for the novice. I often have a problem doing research or working on my job, but I always receive a good suggestion from Assistant Professor Dr. Panisha and Lecturer Julalak. It keeps me going, and it shows that teamwork leads to success within the time limit. And my mentor said I am open-minded and curious, which make her willing to train me. So I think these characteristics are really important. And I had a chance to join the ACAP study tour on food care challenges, which inspired me to work in caring for the elderly. From the gap of knowledge of previous study that I mentioned, professional nurse in Queen Sawang Watana Memorial have limitation of knowledge, attitude, and practice. So I will improve those knowledge, attitude, and practice by collaborating with a good network to manage and transfer the knowledge. The following research title is Dementia Care Knowledge Management. This slide shows network collaboration, concluding the first national or international government or private organization such as university, active aging consortium in Asia Pacific. The research team are lecturer Julalak Chaipang, assistant professor Dr. Parisha Bunsawat from Sripaurintila Thailand Institute of Nursing, and other professors from Thailand. And the research member are Associate Dr. Susena Nugraha from Lespati University and Professor Emerita Takeo Ogawa from ACAP. Next, the following network concluding hospital and community healthcare. This is a network collaboration from previous research, such as Queen Sawang Watana Memorial Hospital, Suan Sararom Hospital, Lambang, จ้าพระยายมราช and Khon Kaen Hospital. And the following network collaboration is older adult and their family. For my research, dementia care knowledge and management, the research aimed to transfer knowledge and on dementia care and screening for elderly with dementia to enhance the competence of professional nurse. The research process are following: 1. Develop a strategic plan to manage and transfer the knowledge. 2. Conduct the knowledge transfer. And 3. Address dementia care and screening on agency policy. Now I bring you to see the first step of research process. I will develop a strategic plan by brainstorming meeting between the researcher and key personnel of the agency. The right picture shows the MOU between Queen Sawang Watana Memorial Hospital and research team to develop a knowledge management plan. Second, I will conduct the knowledge transfer by using collaborative network to provide professional nurse with knowledge on dementia care and screening. For outcomes are concluding, professional nurse have increases knowledge, attitude, practice, and could screen for dementia. 2. Older adults receive dementia screening services. And 3. Expanding the transfer of knowledge to professional nurse in other hospitals. Third, I will address dementia care and screening on the agency policy by providing recommendation for nursing agency in other hospitals. Expected outcome is concluding set a strategic plan or policy for other hospitals. The This project has been submitted to National Research Council for Thailand and is waiting for funding. Now I am preparing the research to submit for research ethics approval. In the future plan, I plan to do research regarding knowledge management and knowledge transfer in dementia care and screening to enhance caregiver knowledge, attitude, and practice. And finally, I think the research begin with establishing standard and ethics for the researcher, with a primary focus on development of common good. And thank you, ACAP, for inviting me to be here. And thank you, all our participants.
Thank you so much, Narimon. Thank you for your hard work. And if I can be a scholarship funder, I will give to you all. Amazing work. Yeah. Amazing. Yes. And I think you sent to us very touching, particularly your experience, and you share what you think. And this is we can hear from you. And I think this is very important for us to know what the young generations like. And yeah, the future will be in your hand. So we are very happy to know that you want to do more and more on this. And I like your connection, your network with other country as well. Yes. I think maybe some people will have a question for you in the chat box. Now we come to the last presenters, last but not least. And yeah, she's very have a very long experience in community health nurse from Australia. And she will bring to us improving integration of care through nurses' assessment of complexity in older people receiving community-based care. She's a Jennifer Book, who is a research fellow at Care Economy Research Institute, and she is also a PhD candidate at La Trobe University, Australia. Jenny, time for you.
Thank you. And I want to thank everyone as well for this opportunity to present today. Last presentation in the day is always difficult, but I think I've actually got the easy job because the introduction of aging has already been given. So a couple of my slides might be quite quick, so that I might be able to make up a little bit of time. But some amazing presenters today and some fantastic research out there. I'm probably a little bit older than most of the other researchers that are presenting today. I'm towards the end of my nursing career, but just starting my research career, and certainly enjoying it very much. So yes, I am a PhD candidate, and Irene Blackberry is my primary supervisor, who is a member of ACAP. So I'm very grateful for this opportunity. Why can't I move to the next slide? There we go. So I'm going to provide you with an overview of my whole thesis. So 6 years of work in 10 minutes is difficult to do. So I'm sure it will generate some questions. Feel free to contact me if we don't get time to answer them all today. A very brief background of why I'm doing my study and what the gaps are, the methodologies, the study location for you all who are not in Australia, my research questions, study design, results, and my conclusion where to from here. So I'm not going to go into very much detail on aging. You all know that the community is aging. From a nursing perspective, the complexity of people in the community is increasing as reforms change and improvements change in the hospital system to discharge people earlier. That has a flow-on effect to more complexity in the home. People are more acute leaving hospital. Aged care reform in Australia is also changing how we manage people in the home. The priority is to keep people in home rather than going into a residential care facility. And yes, definitely in the literature, complexity is increasing for people who live at home. The methodologies for my study was a realist approach, and using a realist approach, I evaluated a pragmatic trial. I'm just going to move things out of the way so I can actually see things. That explored the effect of using a complexity tool in addition to usual assessment in the community on detecting complexity and making decisions, subsequent decisions for nurses. I also used participatory action research, and I used co-design with to explore the differences between nurses and allied health professionals' perceptions of complexity and how they made decisions, and then what they did with that information after making that decision. So my study was conducted in a small town in Victoria. Well, it's a reasonably sized town actually in Victoria. So Australia is here, Victoria is down the bottom of Australia, and we are central. We're sitting right in the middle of Australia. We've got a population of about 165,000 people now, and we service quite a large area outside Bendigo as well. So my research question, my overarching question was, how is complexity of care defined and detected for community dwelling older people? How does this detection impact decisions regarding care planning and resource outcomes? So the first thing I did was a scoping review to explore what was out there, what was currently happening, and could we use what was happening in our small town in Victoria, or reasonably sized town in Victoria. We identified one tool to use. There were 4 tools that we found in the study, in the scoping review, but only one tool actually looked at the holistic aspects of determining complexity for older people. The tool was validated using a rash analysis in Wales, a similar program to ours in Wales. Then I conducted a randomized controlled trial to explore if the patient complexity instrument, the PCI, in addition to usual care, so added to usual assessment versus usual care alone, to enhance the detection of complexity of nurses' decisions and delivery of appropriate care allocation for people aged over 65, which is the funding model. And I apologise for that typo there. I will fix that. Then the co-design looked at how do nurses and allied health professionals, excuse me, sorry, I've got a cold, in regional communities around Bendigo. So it was quite I think it was about 5 smaller rural areas around Bendigo. How do they interpret to determine complexity, and what do they use, and could an instrument like the patient complexity instrument be used in the community? So my RCT looked at clients that were referred to the community nursing service in Bendigo. Participants themselves, so the clients themselves weren't consented, but the nurses were. I used the client's assessment. So the nurses delivered an assessment on the clients. I used the decisions that the nurses made out of that assessment in this study. So the participants were the clients, and I guess the virtual participant was the client's assessment in this study. So I only had to consent the nurses for this study. Randomization was blocked 4x4. And I also collected nurses' feedback as well throughout the study. So we had a control and an intervention group, and field notes were taken as well. The co-design component of the study, it actually came out of the RCT. So in terms of integrating my study, it started with the RCT, then moved to the co-design focus groups, and then we integrated, or we interpreted all of the data right at the end to create a toolkit. So the participants in the focus groups were consented, and they also were asked to get permission of their organisation to participate in the study. And another typo I've just noticed too. So invitations were sent out to the whole of the Loddon Valley region, which is a quarter of Victoria, just over a quarter of Victoria. So it was a large group of people that it was sent to, organisations it was sent to. And then the focus groups included nurses and allied health professionals. I think we had 18 in total in the end, and a lot of these services were multi-health services. They provided a huge range of services. The outcome of the focus groups was the request to develop a toolkit. So I've had ongoing communication with the members that participated to develop a toolkit to support decisions out of complexity. I have a bit more about the results. So the RCT results itself. So the primary outcome was looking at the PCI added to usual care, and did it change nurses' levels of assessment? It actually didn't. It made no difference to the ratings that the nurses gave to the level of assessment. I wasn't actually surprised with that, because the nurses, even though they said our clients are complex, we don't know how to determine their complexity, they actually do better than they think they do. So this study showed that. But I guess the biggest outcome was the secondary outcome, where the patient complexity instrument gave them a tool to then think more broadly about what they were doing with the client, what services they offered for the client, and it aided them to then allocate resources more appropriately and optimize interventions for care. So it actually did have a good outcome. So the process evaluation showed the PCI to be a very user-friendly tool, and it complements nurses' clinical judgment. I never set out to replace nurses' clinical judgment. My intent was to support nurses to make decisions, whether they were junior nurses or more advanced nurses, and I think we've actually achieved that. We emphasize the importance of building a positive rapport with older people, definitely as part of the process evaluation. This is a crucial aspect of nursing for accurately detecting care complexity before using any validated tools like PCI. It encourages the client to openly share and discuss their needs, and this was a barrier that was highlighted throughout the whole study, was the need to add more time to develop a rapport. The outcomes of the co-design showed that nurses and allied health professionals think their conversation starts with their own discipline around complexity, but the more they talk and the more they talk with each other, they become more holistic in their conversation. So if you leave the clinicians on their own to make decisions, they could potentially just make decisions focused on their own discipline. But in the community sector, as many of you will know, we work together. We are never on our own. We have the option to come back into the office at the end of the day and value add to our clients by having a conversation. So that was highlighted definitely through the focus groups. The need to understand the client's health conditions and the services they currently use was definitely highlighted. I'm not going to go through all of these in the views of time. The role of the multidisciplinary team, as I said, we need to talk to each other, and I think there's a lot more work we can do to make that more a formal process rather than an opportunistic thing. Oh, if I'm passing so-and-so in the hallway, what could I do about this? Let's make it more collaborative. We do have multidisciplinary meetings, but the attendance of those meetings is not routinely diverse. So I think nurses with every allied health discipline should be presenting at this team, and not like attend the meetings even if there's a topic that you're not interested in, because you're going to have something to contribute to that. We talked about barriers and enablers to detecting complexity in the focus groups as well. And the one thing that was not surprising is the quality of referrals to community services was often lacking. And the part of that was the lack of understanding of the referee. So they didn't understand the service that they were referring to. They just thought, oh, allied health, they'll go and fix it, or nursing, they can do everything, they can fix it. And there's some things we just can't do. So knowing who to refer to is definitely a big problem, and I certainly haven't answered that with my study. Time for assessment and follow-up care. So as part of this, we've adjusted the time for that first visit for the unknown, because we often don't know, because the quality of the referral is lacking, we often don't know the situation we're going to walk into. It could be a lovely, nice, clean home that they just need help with wound care or something like that, or it could be a home that the people are living in squalor and there's clutter all throughout the house. And then you have to negotiate a clear space to deliver the care. And safety is certainly a big issue as well. So in terms of integrating my research, as I said before, my RCT and the analysis of my RCT led to the focus groups to explore, can we develop some other tool that's going to support decisions? Yes, the PCI has an impact, but there's more we can do. So yes, I might have a client who has medium complexity, but what do I do about that? What does that mean from a referral perspective? So there's 6 aspects of the complexity tool, and I haven't talked about those because I didn't have time to fit it into my slides, but it covers a holistic aspects. It covers how engaged the client is, what their social needs are, what their biomedical needs are, and how well they understand those needs, the environment, safety, how engaged family is. So it covers off a lot of things. So what we've done as out of the focus groups and then with the RCT staff as well is we've built a toolkit that breaks down each of the aspects that are in the patient complexity instrument and gives ideas about what you could do to improve the engagement of that person or improve how safe their house is. So that has been a really good outcome. So conclusions and future recommendations. So we need to look at the learning effectiveness in over time. Certainly being an RCT in a real world setting, I could not limit that. I could not remove that effect. And I believe there was an effect over time. The collaborative nature of the nursing workforce would have contributed to that as well, because the nurses would come back at the end of the day and talk about the PCI. So the nurses that weren't part of the study or that hadn't had an opportunity to use the PCI yet were being exposed to it just by talking. So there was definitely a learning effect over time. So exploring that a bit more would be really helpful. The triage nurses weren't part of the study, and the factors that they take into consideration when setting up that first visit, I think needs to be considered in a future study. They are the most robust detectives in finding out as much information as they can, but they don't always get it right. And when they don't get it right is when the staff walk into something they didn't expect. So there's not that many times that happens, but it does happen. And then does the PCI improve outcomes for patients? So does it mean that that they get services quicker? Or referrals quicker, because often the services still aren't available, but do the referrals go out quicker? Are we stopping them going to ED, to the emergency department? Are we reducing admissions? So looking at that would be really good in the future. We've also modified the PCI to be able to set up a trial as a self-assessment tool. So can we give this to consumers to be able to rate themselves and try and be engaged in their healthcare and improve their own rating of complexity? And then we need more quality activities around the collaborative practices that are happening. And certainly continue this conversation about client complexity. It is definitely something that needs to continue. So thank you. I hope I've gained back a little bit of time here today, but thank you so much for this opportunity. I've got 3 publications out that you can find. The RCT results is currently in preprint, but it's in final review at the moment. So hopefully that will be published very soon. It is available by that link though. So thank you so much for this opportunity, and well done to everybody else who's presented as well.
Thank you so much, Jenny. This is amazing. You have left so many points for the community health nurse to do, and I hope that you can do more on this area. And Irene Bakery will be very, very happy with you. Yes, and you remind me about the role of the community health nurse. I have been there before, but I know that there's so many dimensions. There's so many factors that affect the work, and yeah, your work is so excellent that you can bring some complexity and show the people how to do it. Yeah, and I also love the publication. I will go through it. Yes. Now we
you.
go to the last part of the webinar today. Thank you all five presenters today from the Green Space in the Hawaii. And yeah, you may have some question. I'm not quite sure whether you write some answer there or you want to show now. From Kanya Park Ngausi, also I saw your answer in the chat box. Julalak Chai Pang, and you have some question, and you also answer the questions. And Narimon and Jenny. So now, shall we have one question on this now, so that we can hear from our presenter? Is it Brian? You want to have some idea? Because I saw your message in the chat box. No, you cannot hear from me. Anyway.
Brian, you had a lot in the chat.
Yeah. So I think it's time to end, right?
Well, I
Okay.
just think it was a wonderful session and I learned so much. Thank you everyone for coming, and thank you, Kaysorn, for doing a great job moderating today. I was really impressed with all of the research that's going on and that is planned among you. And I just wish all of you the best in as you know, whether you were a gerontologist first and a researcher second, or a researcher first, a gerontologist second, you're all part of the family. So this is just a wonderful, it's been a wonderful, wonderful webinar. Thank you so much. I hope that you can join us later. I don't have a schedule for next year, but this is a great ending to our 2024 webinar series.